Hi, this is Linda from BariatricTV.com. I'm here with Dr. Baker at the ASMBS. Dr. Baker, can you tell us a little bit about what the ASMBS does? I know we reference it a lot on our show, but I don't think our viewers really have a good understanding of what actually you guys do.
The American Society for Metabolic and Bariatric Surgery is the leading organization promoting the treatment of obesity. We're trying to lessen the burden of obesity and related diseases throughout the world.
Dr. Baker, what is the ASMBS doing to further patient access to weight loss surgery?
Access to surgery is not the only focus of the ASMBS. The Society would promote the treatment of obesity at all levels. We need to address treatment of obesity for our children, our adolescents, our young adults, even our patients that are approaching Medicare age. Mm-hmm. Obesity should be treated when individuals are overweight, have class 1, class 2, class 3, or even severe obesity, because we need to reduce the burden of the diseases associated with obesity. For example, we need to address interventions so that individuals that have a pre-diabetic state and their BMI is 29, they have metabolic syndrome, that they don't go on to develop diabetes and other complications later. So treatment should include not only surgery as a tool, but should include better lifestyle encouragement for increased exercise, better meal plans, more nutritious foods, for example, in the schools with our children. These are important things that should be done not just on behalf of the society, but in society at large, in terms of trying to lessen the burden of obesity.
Can you talk to us a little bit about denial of access to care?
Well, when patients are denied access to care and they can't get access to treatment that may be the most effective treatment for resolution of obesity-related diseases, other diseases start to come along. For example, they may develop further hypertension, may develop diabetes, develop the end-stage related complications of diabetes and other diseases. There are several studies that talk about patients that have had surgery, and it talks about the improved longevity, improved quality of life, and reduced mortality from diseases like diabetes, cancer, and heart disease. The ADAMS study published in the New England Journal of Medicine showed that patients who had surgery had a reduction in diabetes-related mortality of 92%, cancer of 60%, and heart disease of 56%. Christow's study from Montreal also showed that patients who had surgery had a lower risk of cancer. So if we have a procedure or therapy that can improve longevity and reduce diseases like diabetes, heart disease, and cancer, and reduce the mortality related with that, is it unethical for insurance companies to continue denying access to this level of care?
And what can we as patients and families of patients do to help?
Advocacy is very important. When we go to Washington, and we've been there a number of years trying to ask for treatment of obesity with our elected officials, we've educated them. We've been to members of Congress, both the House and the Senate. For example, last fall in discussions about health care reform, we approached and spoke with the healthcare policy liaison for Senator Baca, Senator Durbin, Senator Enzi, Senator Lincoln, Senator Reid, Speaker Pelosi. And we asked that treatment of obesity be an essential benefit in any health care plan, according to evidence-based guidelines. And yet you don't see it in the health care plan today. It's an important thing that patients become advocates. If patients start to speak up, they're going to listen. When I go there, I'm just viewed as a surgeon wanting to operate. Even though I represent a society, an example with my own representative last summer who said, "John, I just can't legislate surgery because I asked him to champion treatment of obesity." Again, that's an example of some of the difficulties in trying to educate not only our lawmakers, but the public at large. We need to have treatment of obesity at all levels.
Well, excellent. Is there anything else that you'd like to say to our viewers?
Keep taking care of yourselves, eat right, eat responsibly, exercise, and live healthy.
Well, thank you very much.
You're welcome. Thank you.